Hi, it's Claire again. I just thought I'd update today because I had my pre-op today. It's Friday the 17th of January, so a few days away from surgery. I've been to see the nurse today and gone through all the pre-operative questions and things like that they do as a routine before most surgeries. And to go through a few medical questionnaires and that sort of thing. My medical history is quite boring, so there's nothing really to worry about in that respect. Took all my observations, blood pressure, pulse, which my pulse was really high today, and I don't know why. My pulse is usually really low. It's usually about 56, between 50 to 60 beats a minute. For some reason today it was like over 100. I don't know why. I checked it when I got back in the car and it was back to 60, so I don't know whether I'm a bit anxious at the moment and it elevated my pulse, but I still didn't feel like my heart was racing at the time, but whatever. Blood pressure on the lower side of normal, as it always is, and that's all fine. I've had to have bloods taken this time as well. I didn't have to have bloods taken before I had my breast surgery, but this time they've taken a full blood count, a group in Sage to check my blood group, and use an ease as well. Just because this surgery is more risky, there's more chance of me needing a blood transfusion or something like that, so that's why they've taken blood from me this time, and they didn't take it from me when I've had surgery in the past. So that's all fine, so I've just got to wait and hope that the bloods are coming back okay, because they won't get the results till Monday, so fingers crossed that they'll all be normal. Because I'm classed as high risk for MRSA, I've also had MRSA swabs as well. Just because I work in a hospital, I'm more likely to carry it than the general public, so I've had to be swabbed for that as well. And again, the results for that will be back on Monday, so hopefully again that's all going to be fine. So that's the sort of the tests and things that they've done today. That's the main reason why I've been down there. I've got some dietary requirements, things like that, because I'm gluten intolerant, so I've had to tell them all about that to make sure that they've got things in to feed me when I'm staying in. I am in hospital for the 2 days. My admission time at the moment is 7:30 in the morning, but that's subject to change, so I have to phone the secretary the day before to find out where I am on the list to see whether that still stands or whether I need to go in a bit later than that. But we're staying over the night before locally to the hospital, so that we're nice and close, so we won't be having to get up and drive at some god-awful time in the morning. So that's fine. They've given me a bottle of Hibby Scrub. For those of you who don't know what Hibby Scrub is, it's like a medical wash, pre-surgical wash. And basically I have to wash my whole body in it the night before the surgery and the morning of the surgery. It's not very nice stuff. It dries your skin out like you wouldn't believe. But it does the job of getting rid of all the nasty bugs and things that you don't want on the skin prior to surgery, so reduces the risk of infection, so that's what that's for, so I have that. They've also given me a spirometer, which is this. Basically what this is for after the surgery, immediately after the surgery. Because they tighten your muscles up so much, it actually makes it very difficult to breathe deeply into the bottom of your lungs, so you tend to shallow breathe. Obviously you're not going to just stop breathing, so you're going to carry on breathing, but you're just going to take little shallow breaths into the top of your chest instead. And what happens is if you carry on doing that, then you can end up with like mucus and things left in the lower alveoli in your lungs. So to help you to shift it, they encourage you to do deep breathing exercises, which aren't the most comfortable things in the world apparently after you've had a tummy tuck, but needs must. So they've given me this to help me with that. Nurse has shown me how to use it, just to ensure that I'm using my lungs, my full lung capacity, so that I don't have any nasty problems with pneumonia and things like that potentially can happen if you're not using all your lung capacity. So that's that part of things as well. I'll have like a girdle that will hold everything in place after the surgery, but I'm not given that until after the operation. I wake up in one in recovery, and I'll be given a second one as well so that I can wash one where I want. I'll also have 2 pairs of lovely thromboembolic stockings, which are thigh level ones, and they're absolutely awful. The knee high ones are bad enough, but the thigh high ones are just horrific. But because my mobility is going to be so reduced, it's to reduce the risk of getting a blood clot, and I'm certainly rather wear the stockings and have a blood clot. So that's that. What else have they said to me? Oh yeah, that I might not be catheterised after all. I thought I was going to be catheterised after the operation, but apparently they're trying to avoid doing it as much as possible now. So they'll only catheterise me if they've been really struggling to get me out of bed. So I'll have the operation on the Wednesday, and they will try and leave me as long as they can after the surgery, and then get me up for a wee after so many hours. but I remember last time when I had surgery, GAs really mess around with my waterworks. It takes me ages to actually feel the need to wee, so I need to bear that in mind, because obviously if I'm drinking loads after surgery, which is something else that I tend to do after I've had a GA, I need to make sure my bladder's empty because it's going to cause damage otherwise. So if I'm not weeing, I need them to catheterise me, but hopefully, fingers crossed, I'll be up and about and able to take care of that myself, because I really don't want a catheter if I can help it. So that's that side of things. So like I say, I'm in for the 2 nights, and I won't actually get discharged until late on the Friday. It's not a Friday morning, it'll be late in the afternoon. So they're going to leave the infusion, the local anaesthetic infusion into my muscle, in until about 4 o'clock on the Friday afternoon, to make sure that I've had the full whack of that pain relief before I go home. So I'm going to be in all of Wednesday, all of Thursday, and most of Friday, just not Friday night. I discussed the fact that I don't deal with painkillers very well, and that last time when I had surgery I was very, very sick afterwards. So I just need to discuss that with the anaesthetist on the day of the op, so that they can avoid giving me as many, avoid giving me opioids if possible, just because they're the ones that tend to make me hurl, and I really don't want to be sick after I've had this tummy tuck. So they're going to try and do everything they can to avoid that from happening. So like I say, it's something I need to discuss with the anaesthetist on the day, but I've made them aware of it. So that's that. I've got some paperwork and things like that that I need to fill in that the hospital have sent me. Again, most of it's just, for my information really, about the date of the operation, what it is I'm having done, what I've agreed to and everything else, and asking me for the rest of the money, which I have paid today. So I'm now skinned, flat broke, no money in my bank account whatsoever, nothing, not a penny. But, it doesn't come for free. Good surgery costs money, and I've worked my backside off to save the money for it. I haven't had a loan or anything like that, or put it on my credit card. I've paid for it myself. I've, worked hard and saved my money and done without other things. So I'm proud of myself for doing that, because I have managed to save for it myself without asking anybody else for any handouts. So that's good. So it's paid for. So it's done. It's paid for. The pre-op's done. I've had everything. I've got all my stuff ready. My bag, it needs packing, but I'm not going to do that until the day before, because I'll be in and out of the things that I'm packing. And that's it. And it's like days away now, because we're on Friday, and I travel down to the hotel that we're staying at on the Tuesday. So I've got tomorrow off with my family. I've got Sunday when I'm working. I'm on a 12-hour shift. I'm working a 12-hour shift on Monday, so that's going to take my mind off it a little bit, which is probably a good thing, to be honest, at this stage. And then Tuesday, it's a case of last blitz at the gym, so I'm going to go into a couple of classes on Tuesday morning and get my last hit for a long time. So I'm going to give it everything I can in that, and then it's a case of taking all the animals everywhere, so cat and bunny and all that sort of stuff, to the boarding kennels and things. Pack my bag, get in the car and go. So that's where I'm at. I can't believe I'm days away. It's just unbelievable. I've wanted this operation done for at least 2 years now, since I lost all the weight, and now it's finally here, it's finally happening. So I'm dead excited. I can't wait to get it done. I know it's going to look worse before it looks better, so that's quite scary, because I don't really know what, well, I do know it, I know exactly what to expect. It's going to look horrendous, but when seeing it on somebody else and seeing it on yourself are two different things. So I'm not looking forward to seeing all that, but at least I'm realistic, and I know it's going to look horrendous before it looks better. So I'm going to try not to concentrate on that too much, but and think about the long-term effects. I certainly did that with my breast surgery. They looked awful to start with. I mean, they didn't look as bad as they did pre-op, but they didn't look right, and it took a good few months for me to start seeing the results of it, really. So I was quite patient last time, so hopefully I'll be patient this time too, and not drive myself too mad with it all, because it sort of becomes all encompassing. Because when you're at home recovering, there's nothing else to think about, because you can't go to the gym, you can't go out shopping, you're not working, you're not really seeing anybody. All that you can think about is your recovery and the operation that you've just had, and why you put yourself through it, and all this sort of thing. So it's easy to become completely engrossed in it. So it's something I need to bear in mind, because I know I can sort of concentrate on things a little bit too much like that and become a little bit obsessed. So I need to make sure I don't do that. I've got loads of friends and family that said they're going to come and see me and keep me entertained in the couple of weeks that I'm recovering, so that's good, because I need that. I need that support network. Yeah, so the next time I do an update will be when I'm in that hospital. So that is the next video that you'll see from me, will be probably when I've arrived at the hospital and how I'm feeling at the time. But at the moment, this much scared, this much excited. It's probably going to go the other way the next time I do the video. But yeah, so we're on. So see you soon. Thank you very much for listening to me waffling on again about this operation, and I hope it is helping people, anybody that's thinking about having it done. So keep watching out, and there'll be another video in less than a week. So see you soon. Bye bye.